everyone, this is Suprabha. Welcome back to another session with me. In today's session, we will be dealing with another hemolytic disorder, which is iron deficiency anemia. So let us first understand the meaning of iron deficiency anemia. So we know what we mean by anemia, right? So when there is, reduction in the amount of RBCs, right? When there is less red blood cells in the body, we call it as anemia, right? Now here we are referring it as iron deficiency anemia. That means when there is anemia due to deficiency of iron, we call it as iron deficiency anemia. So basically, iron deficiency anemia is a microcytic anemia. Now, what we mean by microcytic anemia that we will see in the later slides. But first, let us understand, how this iron deficiency is related to anemia, right? So, iron is basically, it is essential for, for hemoglobin. So, iron makes hemoglobin. Now, why we are saying iron makes heme? So, if we divide the word hemoglobin, we get heme plus globin. And also, if we look at the structure of hemoglobin, we can understand that, each of these hemoglobins are made up of globin chains, right? And each of these globin chains are bound to a heme group. So here, the iron makes heme actually. And if there isn't enough iron, then the body cannot make heme, right? And if there isn't heme, then, the body cannot make hemoglobin. So as a result, there would be microcytic anemia where the person would end up with really small red blood cells. So basically, if we, when we are saying that microcytic anemia, that means in general, we can say that the person would have really small red blood cells. Now, what happens when there is deficiency of iron and the body isn't able to, make heme, and because of that there is lack of hemoglobin? What would happen? These RBCs would have very few hemoglobins, right? So the person would end up with, RBCs with very few hemoglobin. So basically, at this stage, there are RBCs, there are normal RBCs, but it has very few hemoglobin in it. So the body would, respond to it. And how it would respond? It would respond to it by cutting it into half. So that, that's how the person would end up with small red blood cells. So when the body would respond to it by cutting it into half, the person would have small red blood cells with hemoglobin in it. So that's how microcytic cells are produced, and also that's how iron is related to RBCs, because iron makes heme, and if we don't have enough iron, we can't make heme, and if there isn't heme, then we cannot make hemoglobin, right? And you know that how important it is for the RBCs to have hemoglobin, right? Because hemoglobin is an oxygen carrying protein, so we need hemoglobin to, to transport oxygen to the tissues and organs. Now, what might be the cause of iron deficiency in a person, right? Now, perhaps it might be, that the person isn't taking enough iron, or, there isn't, the iron isn't getting absorbed in the body, right? That's what we generally think when we talk about deficiency of certain things, right? So here in iron deficiency anemia, the first and foremost cause could be blood loss. Now, in which all cases there might be blood loss, right? So, first thing can be that there might be, heavy menstrual bleeding. So, in case of young women, there might be, heavy menstrual bleeding, and because of that, they would lose a lot of blood, right? So, when there is loss of blood, there would be also loss of RBCs, right? And with the RBCs, there were also the hemoglobin would be lost from the body, and also the iron would be lost from the body, right? So the person would end up with iron deficiency. Next, apart from heavy menstrual bleeding, there might be hookworm infection. So in case of hookworm infection, what happens? The hookworm latches to the gastrointestinal wall, and these worms, it sucks the blood out of the GI tract. So what would happen? They would lose blood continuously, right? So again, there is a chance that there would be iron deficiency in case of hookworm infection. Now, apart from blood loss, there might be less intake, and less intake is very common in infants, and especially infants who are less than 6 months old. Now, why is it? Because their major diet is breast milk, and if we see the contents of breast milk, we can understand that it's a very poor source of iron, right? So that's the reason these infants might have iron deficiency anemia. Also, apart from infants, there might be poor diet also. So in some cases we can see that some children, they might be vegetarian, or they might be malnourished also, and they might not take enough iron from their diet. So that might be a cause of iron deficiency anemia. Next is an inability to absorb enough iron from food. So basically, how this iron is absorbed, that we have to understand, right? Now, when we eat something, right, when we consume iron, what happens? Almost all our nutrients, including iron, is actually absorbed in the duodenum. So before reaching the duodenum, the food actually passes through the stomach, right? So the iron would actually pass through the stomach. Now, what is there in the stomach? There's a lot of acid, stomach acid, right? So these stomach acid, what it does, it would convert the iron into a form which is more easily absorbed through the duodenum. So here there are two important things, right? The first thing is that it has to pass through the stomach acid, because the stomach acid would convert it into a form which would be more easily absorbed through the duodenum, right? And the second thing is that the duodenum has to function properly, right? Because the iron would get absorbed by the cells of the duodenum. So these are the two important factors here in the absorption of iron. Now imagine if in case there is this absorption is not happening properly, then what would happen? There would be iron deficiency, right? Now, in which all cases there might be, disturbance in the absorption. So again, as I told you that there are two important factors, right? So the first thing can be that there is decreased in the stomach acid production, right? Now, why there will be decreased in the production of stomach acid? In which all cases it might happen? So if there is gastrectomy. So, for example, if they have removed a part of the stomach for, it might be for, gastric ulcer or gastric cancer. In that case, also they might remove a part of the stomach, right? That is what is gastrectomy. So in that case, there would be, the production of the stomach acid would decrease, right? And as we learned that, it's very important for the stomach acid to be there, because that is the only thing which would convert the iron into the form which would be easily absorbed, right? So if there is less stomach acid, then the iron would not get converted, right? And if it is not converted, then it won't be, the duodenal cells won't be able to absorb it. So that is one thing. The next thing can be if there is any duodenal abnormalities, right? So as I told you that, the duodenum has to function properly, right? So if the duodenum is not functioning properly, then again, the absorption would get hampered, right? So here, the next thing is if there is any duodenal abnormalities. Now, in which condition it might happen? So if there is celiac disease, So in case of celiac disease, what happens? The child would be intolerant to gluten. Now, whenever the child consume gluten, what would happen? The duodenal cells would react to it, and as a reaction, what would happen? There would be inflammation of the duodenal cells and also destruction of the duodenal cells. So you can imagine, if there is inflammation and destruction of the duodenal cells, that means the duodenum won't be able to function properly, right? So the function of the duodenum would be impaired. So again, that might disturb the absorption of the iron, and that might lead to iron deficiency. Now, apart from this, the next cause can be if there is increased demand for iron in the body. So there are certain conditions where there might be increased demand for iron in the body. So one of them are, if there is the childhood and adolescent period. So in this age group, actually, they would have most of their growth and development, and there would be rapid growth in this age group. So during this rapid growth, we need more of blood, we need more red blood cells, more of hemoglobin, more oxygen, right? So that is why there would be increased demand. Now, apart from this, also, if in case of pregnant women, again, there is increased demand. But as we are talking about the pediatric client here, so we would only, focus on the childhood and adolescent period. Well, so we know how important it is for the iron to be there to make hemoglobin, right? And we also learned that, when we consume iron, how it is absorbed, right? So basically, the iron gets absorbed into the cells of the duodenum, right? But here the iron is not a free molecule. The iron is actually bound to a protein called transferrin. So actually, this transferrin transports the iron into the bloodstream, and then it is sent to the parts wherever it is required. But most of the iron is actually transported to the liver, because liver is the major site of iron storage in our body. So here in the liver, the iron will be stored in the cells called macrophages. And again, here also the iron would be bound to a protein called ferritin. So that is how iron is stored in our body, right? So initially, what happens, when the person would be iron deficient, what would happen? The body would use this, stored iron. Now we said that iron makes heme, right? So how iron makes heme? So let us dive a little bit deeper into this. So let us have a look on the RBC. So here we have RBC. So what we have in the RBC, right? Now we have hemoglobin in the RBC, right? So hemoglobin is an oxygen carrying protein, and this transport oxygen to the tissues and the organs, right? So it is very important for the hemoglobin to be there in the RBC, right? So it is a very important part of the red blood cells. And this hemoglobin is made up of actually heme plus globin, right? So there are 4 globin chains in one hemoglobin, and each of these globin chains are bound to a heme group. So basically, in one hemoglobin molecule, we can see that there would be 4 heme group. And in each of these 4 heme molecules, so we can see that there would be an iron in the middle of it. Now this iron binds to an oxygen molecule. So each hemoglobin, if we see each hemoglobin, we know that in each hemoglobin we have 4 heme molecules, right? And in each heme molecules there are iron in it, and in each iron is bound to an oxygen molecule. So basically, in each hemoglobin can bind to 4 molecules of oxygen. So you can understand that hemoglobin is a transporter, right? So it transports the oxygen to the tissues and the organs wherever it is required, right? So if there isn't enough hemoglobin, even if there is oxygen, it cannot, the oxygen cannot be transported to the, to the tissues and the organs. So next, let us move on to the clinical manifestations. So what are the signs and symptoms that we can see in a child with iron deficiency anemia? So in the name itself, we are saying that, iron deficiency anemia, right? So that means there will be anemia. So the first and foremost thing that we can say that we can see the signs and symptoms of anemia would be present in the child, right? So the child will feel extreme fatigue because again, there is lack of hemoglobin in the body, and there is lack of iron, right? So because of that, there is lack of hemoglobin, and when there is lack of hemoglobin, that means there is lack of oxygen, right? So the tissues and the organs aren't getting enough oxygen. So if that is the reason, the child will feel extremely fatigued. Also, the child will have pale skin because there is lack of RBCs, and the child will feel dizziness. Again, the reason is same, because there is lack of oxygen. So even if the child is breathing enough oxygen, there is lack of hemoglobin to bind with that oxygen and to transport it to the tissues and the organs. So the transporter is missing, right? So that's the reason the child will have dizziness, and there will be tachycardia. Also, the child will have splenomegaly. Again, as there is lack of RBCs, the spleen has to work more. So because of this overwork, there would be swelling in the spleen. So there would be splenomegaly. And along with these things, there would be koilonychia. Now, what is koilonychia? So iron is very important. Iron has several roles in our body, right? So it's very important for our hair, for our nails and skin. So this koilonychia is something where we can see the nails would become spoon shaped. So the shape of the nails would become like a spoon. And also there might be pica. So I hope you know what is pica. The child will have urge to eat weird things which has no nutritional value. For example, dirt. And then there will be irritability. So the child will be irritable and fussy because the child has no energy, the child isn't receiving enough oxygen, and because of that the child will be irritable and fussy. And also there might be delayed growth and development. So for proper growth and development, we need proper RBCs, right? We need more blood, more hemoglobin. So when there is lack of these things, when there is lack of RBCs, lack of hemoglobin, lack of oxygen, so what would happen? There would be delayed growth and development. And also apart from these, there might be kilosis and shortness of breath. So again, the reason is same for shortness of breath, because even if the child is taking enough oxygen, the child is breathing enough oxygen, there is no transporter for the oxygen to reach to the tissues and the organs. Well, so these were the clinical manifestations of iron deficiency anemia. Now next, let us move on to the diagnosis. So for diagnosis, we would do complete blood count and blood smear, right? So in complete blood count, we can see if there is low ferritin level, if the RBCs are less, and in blood smear we can see that if the RBCs are microcytic. So if the RBCs are microcytic, we can find out that this is a microcytic anemia, and also it would be hypochromic in chronic cases. And also apart from these things, we can do serum iron, total binding capacity, and serum ferritin. So these things would tell us what is the real cause behind iron deficiency. And we can also do stool testing. Now, why stool testing? So if you remember in the causes, we said that one of the major causes is blood loss, right? So if we find blood in the stool, we can understand that there is blood loss from the body, which most of the time which would be unnoticed, right? So if there is blood loss from the body, that might be a cause of iron deficiency. So for example, in case of colon cancer, or if there is gastric ulcer, all those cases, there will be there would be blood in the stool. So that would also indicate, or that would also give us a hint that if it is iron deficiency anemia, or what is the cause behind iron deficiency anemia. Well, so next let us move on to the management. So basically, iron deficiency anemia is managed pharmacologically. So the child will be given oral iron supplements. So ferrous sulfate is mostly used, and it would take 3 to 6 months to replenish the body stores. Also, one more thing is we can give oral supplement then only if there is normal absorption. So if there is problem with the absorption, then even if we provide oral supplement, what would happen, this iron won't get absorbed, right? So we have to find out if there is problem with the absorption, then we cannot give oral supplement. And next is parenteral iron therapy. So parenteral iron therapy is also given for some children. It depends on the severity of iron deficiency anemia and also the cause behind it. Well, next let us move on to the nurse's responsibilities in taking care of a child with iron deficiency anemia. So if you are taking care of a child who is suffering from iron deficiency anemia, then what are the interventions that you would take up? Right. So the first thing would be monitoring the child carefully. Now, what are the things that you would monitor? Right. So the first thing would be that if there is any spontaneous bleeding from from anywhere from the body, right? So if there is spontaneous bleeding, that would cause iron deficiency, right? So you have to monitor the child, you have to see if there is bleeding, and also you have to monitor the child for signs and symptoms. So that would tell us if the child is responding to the treatment, and also the severity of the anemia, right? And if the signs and symptoms are worsening in nature, right? So you have to monitor the child very carefully. The next thing would be administering the prescribed medications as ordered, because most of the time iron deficiency is anemia is managed pharmacologically, right? So here you have to make sure that you are providing the medications, you are administering the medications how it is ordered. Also, you have to reduce fatigue in these children. So we have already learned that the children would feel extremely fatigued, right? There would be extreme fatigue in these children. So you have to reduce that. Now, how you can reduce that? So as a nurse, we have to plan their daily activities. We have to make sure that the child is taking enough rest. The child is not doing any strenuous activities, right? So that is how you have to reduce fatigue in these children. The next thing is about educating the parents. So you have to educate the parents about the food rich in iron, right? So you have to educate them that how they can include more iron in the child's diet, right? So you have to instruct them that they can include more of meat, green leafy vegetables, and also beans. So these are rich in iron, and they can include these things more in the child's diet. Also, you have to make sure that the parents understand that when to take the iron supplements, right? If you are giving oral iron supplements, you have to make sure that the parents know that when it is supposed to be given, right? So you have to instruct them that the child should take the iron in an empty stomach, because that would increase the or enhance the absorption. Also, you have to explain to the parents that they should not give the iron supplement to the child with any sort of milk products or calcium supplements or antacids. So you have to explain to them that why it is important, because this might interfere with the absorption of iron, right? So you have to instruct the parents that there should be 2 hours of gap in between intake of these two things. So if the child is taking milk, then they should wait for 2 hours and then they should give the iron supplement. And also you have to educate the parents that it is normal that the stool would look dark, because the child is taking iron supplements, so the stool would become dark, but it is not normal if there is blood in the stool. So in if they find out any sort of problem like this, if there is blood in the stool, they should notify the physician. But if the color of the stool is dark, that is completely normal. So you have to educate the parents about that. And also at last, you have to make sure that the child is taking enough water. So you have to encourage, as a nurse, we have to encourage the child to drink more water, because as a child is taking iron supplements, the child will be prone to get constipation. So to avoid that, we have to encourage the child to drink more water, and we have to make sure that the child is hydrated properly. And the same thing, you should educate the parents also that why it is important to keep the child hydrated. So apart from nurses, the parents also should encourage the child to drink more water. Well, so that's all about today's class. So let us conclude our today's topic here. So today we learned about iron deficiency anemia, right? So that means when there is lack of red blood cells due to deficiency of iron, right? That is what is iron deficiency anemia. And we know iron is very important because iron makes heme, and if there isn't enough iron, then we cannot make heme, and if there isn't heme, then we cannot make hemoglobin, right? So we also learned about the management of iron deficiency anemia. I hope you have got a better insight about the topic. Thank you.